Welcome to Radnor Health Matters. I'm Amy Wishner. I'm the chair of the Radnor Township Board of Health, and I'm delighted to have with us today Dr. Joshua Rabinowitz, DO, Fellow of the American Academy of Pediatrics, and Dr. Rabinowitz is the Chief of Well Baby Nurseries at Mainline Health, Director of AdvoCare Newborn Network, and a partner in AdvoCare Mainline Pediatrics. Welcome, Dr. Rabinowitz.
Thanks for having me today.
Thank you so much for giving your time. So today we're here to talk about breastfeeding, and we'll talk about a lot of different aspects of it. So let's start with what are some of the major health benefits of breastfeeding? There are huge health benefits of breastfeeding. Lots of research being done and has been done showing us about the positive health effects on babies and mothers. As far as infants are concerned, kids who breastfeed have lower incidences of infectious disease, lower incidences of obesity, diabetes, even lower incidence of SIDS has been shown as well. Why do you think that breastfeeding leads to a lower incidence of obesity, or what's some of the ideas about why that might be the case?
Newborns, when they're feeding, learn to manage their own satiety. You know, so a nursing pair, dyad, mom and baby, they work together, and there's research done to show that babies learn how to manage their own intake, and it may there's a lot of work being done in the area showing that. Yeah,
I mean, I would guess also that there wouldn't be, that if you're bottle feeding a baby, on the one hand you might want to kind of finish everything in the bottle, and there might be almost like a sort of like force feeding kind of thing, or the idea of propping the bottle up, which you're not supposed to do. But again, you know, it's not like, I could see how that would happen. So with breastfeeding, I would think, you know, you wouldn't have that quite that same impetus to feel like, oh, I have to get this much into the baby. So
right, exactly, there is a tendency to overfeed when we're using bottles to feed and feeding formula.
So and how does breastfeeding benefit the new mom?
New moms are benefited by bonding. Certainly, we love the first hour of life is called the sacred hour. Once a baby's born, we like the kids to be skin to skin on the mom. A lot of times the babies will actually find the breast, and sort of just nature takes over, and they find the nipple and learn and start sucking. And that builds a really strong early bond. Babies who are placed on the chest initially, skin to skin, do very well. They succeed in breastfeeding better than if they don't have that time. And it's a really strong bonding situation. So moms, when they breastfeed, stimulating the breast then tells the brain to release both oxytocin and prolactin. Oxytocin helps clamp down the mom's uterus, and it's also a feel-good hormone. And prolactin helps turn on the help lactogenesis, to help the milk start to come in. These are natural things that have occurred for time immemorial. And so that's very helpful to the mom, and so it's a wonderful bonding experience. Other things that have been shown, it's shown that mothers who breastfeed have actually lower incidence, not by a huge amount, but lower incidence of breast cancer and ovarian cancer. There's studies showing lower incidence of postpartum depression in moms. And surprisingly, moms who breastfeed seem to get more sleep, not less sleep, because that's a common excuse for moms and families not to breastfeed, is because of sleep. Oh, I need to sleep. So, but some studies show that moms actually get more sleep.
So why?
There are also, I mean, other maternal
sleep.
Why they get more sleep? Because they're into the rhythm of their baby, so they can sleep when the baby sleeps, and they have a better sense of how things are going to go with their baby, being more in tune with the natural balance of the child. Other benefits to the mom are also decreased obesity as well, and also decreased adult onset diabetes.
Are there benefits to the whole family and to the whole community of breastfeeding?
Well, yes. The family unit sort of benefits from that warm feeling that mom and baby have. The nice thing about breastfeeding too is that it's always available, that it's free, and it's the perfect nutrient for the baby. In terms of the family, mom and baby doing well is also allows the partner to do well. In terms of society, I mean, there are many societal benefits to breastfeeding that are more global.
Aren't there some vaccine preventable diseases that when the infant, I know we give the hepatitis B vaccine right at birth or shortly, the first dose, shortly thereafter, while the baby's still in the hospital. But aren't there some vaccine preventable diseases where before the infant is too young to be protected by immunization, they benefit from breastfeeding in terms of some protection?
Sure, yeah. So breast milk, any diseases essentially that the mom has had, she makes antibodies to, and those antibodies pass into the breast milk, and so the baby passively gets some antibodies, especially the IgA antibody, which is protective. So the baby is essentially protected against a lot of the diseases that mom has had in her life and that she's been immunized against as well.
So those are some pretty remarkable benefits, and as you point out, it is the lowest cost alternative.
Yeah.
So,
I mean, just a couple of things, about the early breast milk. Certainly, the colostrum is chock full of antibodies and bioactive proteins that help set up the immune system. And the infant gut is lined. Well, all of our guts are lined by lymph tissue. And the lymphatic tissue is our immune system tissue. About 70% of the lymph tissue is lining the gut. So what we see, what the body sees, is very important, and especially in those first days of life. And so what we like the kids to see is breast milk and the normal bacteria that are there on mom's breast, and also coming through the vagina, the vaginal flora, is very important for the baby to have as part of their basic microbiome, is what it's called. So I think the immune effects of breastfeeding are really, really dramatic and important. What we find as well, studies showing if kids are exposed early on to other proteins, whole cow milk protein per se, that may lead to more allergic kind of disease. So it's interesting in that our body, the inside of our body, is only separated from the outside world by one cell layer. Lining that mucosa of the intestine is just one cell layer from our bloodstream to the outside world. And so taking advantage of nature and the way nature wanted it to be was providing the colostrum early on is important.
And what of these benefits do you still get if you're only able to, for a variety of reasons, partially breastfeed as opposed to exclusively breastfeed?
Oh, I mean, the benefits that we described initially from the colostrum and then just from breastfeeding is wonderful, and even partial breastfeeding is great. It's fantastic for mom and baby. We're lucky to live in an age where the supplemental formulas that exist are healthy. They have good protein, they have good fats, they have, and they have good sugars, and babies grow very well on them. Formula companies do a job trying to replicate breast milk. It's impossible because breast milk is so complex and has so many bioactive components that are really important, but they try, and certainly people who are, babies who are bottle fed are generally healthy as well.
What are the current American Academy of Pediatrics recommendations for breastfeeding?
The American Academy of Pediatrics recommends exclusive breastfeeding for the first 6 months, and then supplemental foods to be added at that time, but also continuing breastfeeding for 12 months. Longer is fine as well. And
in your experience, how realistic do you find that is for your patients, your female patients? Are they just logistically, really, more than medically.
Right. So logistically, it is tough. We live in a very busy world, and most of the mothers that I see are working mothers, and most of them want to breastfeed, and most of them want to exclusively breastfeed, and they try, and they deserve a lot of credit, and they also deserve more help than we give, and so we need to keep giving more help to these to families around breastfeeding. So I have a lot of patients who are able to exclusively breastfeed. If not always from the breast, then people pump and they provide breast milk that way. As we say, lots of women are working. A huge percentage of our mothers are working mothers. Businesses, over 50 people, I think, are required to provide a place for moms to pump, a clean place, not a bathroom. And I think it's important that the business community continue to step up if they want to retain talented young women who want to take care of their babies. They need to also do a good job supporting breastfeeding. It can be certainly having a place for moms to pump, but also providing flexible work hours and things like that so that people can figure it out. A lot of jobs, however, don't allow moms to nurse, and it's a difficult thing to do, to even make time to pump.
Yeah, I think especially in certainly many office settings where you have cubicles and then you have a bathroom, it can be hard to make a good place where really the woman feels relaxed enough to pump.
Right.
And plus to store, someplace safe to store the milk,
refrigerator,
et cetera.
yeah. And I mean, I think that's an important call for us to encourage.
Yeah, but I mean, I think you're right. It's getting better, and hopefully will continue to get better.
The Affordable Care Act does require payment for breast pumps and for lactation support. I wish it were more well defined what lactation support is, but it is there. It's in the law to support moms breastfeeding. 3 years ago, in February of 2011, Regina Benjamin, Surgeon General, had a call to action for breastfeeding, which is really wonderful, and you can see a copy of the call to action for breastfeeding on an email link that we have here. And she was looking to individuals, to institutions like hospitals, to the community, as here, what you're doing with the Radnor Township, and to businesses. As a whole, for all of us, we all can do something to do a better job in supporting moms breastfeeding. If everybody breastfed, we'd save probably $10 billion a year, it's estimated, in medical costs.
Are there medical contraindications to breastfeeding? And kind of on a related note, if a woman wants to know if a certain drugs that she's taking contraindicate or mean that she shouldn't breastfeed, how could she find that out?
Yeah, there are medical medical reasons that people might not be able to breastfeed. HIV infection is one. For the most part, most drugs can be taken. There are some drugs that we should not take and breastfeed. As far as the resources for that, there's a handbook. Thomas Hale has a handbook, and there's websites which you can check to make sure that the drug that you're giving is compatible with breastfeeding.
Are there, I guess, sort of myths that you find are among the more common about reasons why either not, so in other words, mistaken ideas people might have about, a woman might have about why she shouldn't breastfeed, or mistaken ideas about why she needs to stop breastfeeding? Are these things you run up against?
Yes, there are a lot of things that we run up against every day, and there are cultural issues. Some cultures don't believe that you should drink colostrum. They don't believe that their milk is going to come in, so that then they want to supplement very early on. Other reasons, people think that Well, I mean, an obvious thing is in our society, lots of women think of their breasts in a more sexual way and not in a nourishing baby human way. So I think that's an important part of it. So some people come in just like, no, I don't think about my breasts like that. I'm not doing that. And I try to encourage them, tell them how important it is and how healthy it is for their baby. But that's a main thing. People think if they've had breast surgery, whether breast augmentation or breast reduction, some of those folks can nurse. Depending on the surgeon and such, the ducts can still be functional and in place, and so it's worth a shot. But many people will feel like they maybe can't do it for that reason. People who, I guess, are taking certain medicines. Most of the medicines are probably okay for nursing, but a lot of people, they're taking a medicine, they don't want their baby to get that medicine, so they're not going to breastfeed. Those are some of the reasons.
Mm-hmm. Yeah. Let me just look and see what other questions I have here. I've heard about people purchasing breast milk. What have you come up against as far as women who want to breastfeed, for whatever reason are not able to, but still want their baby to get breast milk? Are there any safe places to get breast milk, or really not? If it's not your own breast milk, it's not safe?
It's a great question, and depending on where you are in the country, it's whether some human milk is available. There are human milk banks which do the pasteurization and such, and it's pretty safe to get that human milk. It's very, very expensive.
And are those commercial places or hospitals, or what are they?
I'm not sure. There are human milk banks. They're private, I think, for the most part, but people can access them. We don't have many around here. I don't really know of any local human milk banks. I know in the intensive care nursery, they do use human milk as the supplement for the extreme premature babies. If mom's milk is not in, usually they have their mom's pump, but if mom cannot provide enough milk, then they do buy human milk. In other parts of the country, I know one of our lactation consultants at Lankenau came from the Denver area, and there, even in the well baby nurseries, babies got human milk as a supplement, donated human milk as a supplementation. So it's out there in other parts of the country, recent study, that you don't want to buy human milk on the internet. That's probably not a good idea.
Because?
Well, because you don't know where it's been. You don't know that it's been, sterilized, pasteurized. Just because that's probably not a good idea.
Okay.
So I did have a patient ask me the other day, though, if they could use the sister-in-law's milk until mom's milk came in, because she had a bunch stored. And I said, well, it's a great question, a great idea. I mean, human babies can drink human milk. We drink cow milk all the time. Why can't human babies drink some other human's milk? They probably could, but I'm not going to specifically recommend it. For many years before formula, I'm sure there were wet nurses who fed many children along, throughout time immemorial.
You mentioned lactation consultants. So it's sort of two parts. One is at your practice, do you have lactation consultants, or do you have on staff, or do you have members of your staff who are certified as lactation consultants? And then if someone just listening to this would like to find a lactation consultant, what is a reliable way to do that?
Okay, so it is wonderful. It'd be great to have lactation consultants on staff at all pediatric offices. Some pediatric offices do have a lactation consultant available to them. We have a lactation consultant who uses our office 1 day a week at our Narberth office for the mainline pediatrics. But we have also many community IBCLCs, or International Board Certified Lactation Consultants. And we're lucky in our area to have a number of them. The Mainline Health website that I have that will show up on there, that will take you right to some community resources for lactation consultants.
So you said IBCLC, and that stands for, say it again more
International
slowly?
Board Certified Lactation Consultants.
Okay.
And that's the gold standard of lactation consultants. There are other degrees, other certifications that people get in helping with lactation, and that's wonderful. But the real gold standard, the sort of doctors of lactation, essentially, are the International Board Certified Lactation Consultants. So IBCLC, they spend years to get their degree. They need over 1,000 hours of clinical, but they also have a lot of coursework. So they have to understand the physiology of lactation and, of course, the anatomy.
And as a pediatrician, do you have many families who come to see you before the birth of their child, or really most of the time it's once the child is born they show up at your practice as a new parent?
Right. Well, you get both. Certainly we have a lot of prenatal visits that we have, and we talk to parents before they have their babies. At which point I'm encouraging them to think about breastfeeding, because it's something they should be thinking about and caring about as soon as they get pregnant or before then. But so that's important, as if they can keep reading about it and learning about breastfeeding before they have the baby. That's wonderful. So they learn what to expect in those first couple of days, because they can be very trying days. Otherwise, we do get a lot of patients, to finish your question, we get a lot of patients who hadn't seen us before, but they're just coming to see us. In some of the work I do, I see a lot of well babies that are not going to come to me, not going to come to my practice later, but I'm seeing them in the hospital for those first couple of days of life. And I set up a special practice really to help educate and encourage them to breastfeed, and to support them if they're not, but to really let them know about what they should expect in these first couple of days of life. Babies do lose weight. They can lose up to 10% of their body weight in the first few days of life, and that's normal. When a new mom sees her baby losing weight, it's kind of stressful. So I try to de-stress that, take that away from her concern, so she can keep practicing the nursing. We know babies get a little jaundiced as well, and that usually peaks by around day 4 or 5 of life. So I let them know, oh, baby's a little bit yellow, that's fine, it's the normal amount of yellow for today. Just trying to de-stress them so they can just concentrate on feeding, because the milk's not really in for those first couple of days. So that's sort of my passion, is trying to hold on, and support these moms through the first days, so that by day 3, 4, when their milk is finally in, the baby's getting something to drink, they're starting to gain some weight, that they feel good about themselves, so they hung in there in those first few days.
Is that timeline the same for premature babies, or is it different in terms of when breast milk would come in?
It's similar. I mean, once you're stimulating the breast, it sends that signal to the brain to release the oxytocin and prolactin, so that moms of premature babies, depending on how early they are, right, their milk will come in a few days as well. Sometimes it does take longer. But it is interesting that even if you're born, a month early, that your mom still can make milk for you pretty soon thereafter. The premature babies we do take extra special care for. They're not as good at controlling their temperature and their blood sugars, and so we're more aggressive about feeding them. I mean, we want them to try to nurse, but we'll also get mom to pump to help stimulate the breast, and we'll give the baby whatever mom pumps, and also give them some supplemental formula as well, because for the most part they're going to need some calories to get growing.
How common, just looking over your career as a pediatrician, how have you seen rates of breastfeeding? Have you seen them sort of just over?
Yeah, I guess they have fluctuated. But I think working here on the main line, we're pretty lucky, and we have a very high rate of individuals at least starting to breastfeed. Most people want to do it, and they try, and most people succeed pretty well. But there really has been a stronger push, I think, in the past 3 years. It's really gotten out to the community that breastfeeding really is great, and we should really throw all of our support behind it and help moms be successful with it.
So do you have a ballpark idea of what % of women initiate breastfeeding?
I would
in Pennsylvania or nationally?
I wish I knew the exact figures. On the main line, it's like 85% starting. I don't want to quote the exact numbers, but it's much lower than that around the country, but it is rising. Thanks in part to, well, the Surgeon General's call to action a few years ago, and a group called Baby Friendly USA, which is takes 10. It's a program to help support successful breastfeeding, and they have the 10 steps to successful breastfeeding, which many hospitals are trying to incorporate into their everyday care of moms and babies so that they can be successful with breastfeeding.
Do you happen to remember offhand any of those 10 steps? I mean, I guess is rooming in considered?
Rooming in is one of them, sure. Not supplementing with formula in the first days of life. Getting babies on the chest, so skin to skin in the first hour of life, and trying to get kids to feed in that first hour of life.
In terms of not supplementing, are hospitals in our area, do you have to explicitly say, I don't want any supplemental feeding, or is it something that is routinely asked, or does it just sort of happen anyway, or what is your experience with our area? As we had,
it used to be that it was fairly standard that very well-meaning nurses would say, this kid's hungry, let's give them something to eat, or that they would send the babies would go back to the nursery in the evening time and let mom sleep, and then they would give they would feed a bottle at nighttime for one of those feeds, all well-meaning, trying to support a new mom who's exhausted just having been through labor or had a C-section, and but it's an old style of thinking, really, and we know that moms and babies will do better if we have them stay closer together, and if we allow that baby to nurse more frequently and not give those bottles. Every time we give a bottle of formula, that baby gets satisfied and then doesn't really require mom to feed, and then mom's body doesn't know that the baby needs to eat. That's one part of it. The other part of it is it's a different skill to suck on a nipple from a bottle than it is to suck on nipple from the breast. And kids need to practice. They need to practice to learn how to do it well. And moms need to practice to learn how to do it well. So less and less formula supplementation is happening. We're getting there, I think.
In terms of what you just said, is a pacifier either interfere with breastfeeding, doesn't interfere? As you say, it's a separate skill, but
right, and so
do you advise your parents either?
The interesting thing about pacifiers is that it's recommended that we not use them in the first days of life while the baby is learning to suck on mom's breast. But after a couple of weeks of life, 2 to 3 weeks of life, it is recommended that kids do use pacifiers because there's a decreased incidence of SIDS.
I'm sorry, because
decreased incidence of SIDS in babies who use pacifiers.
Because?
Not sure.
Okay.
Not sure the mechanism, but studies seem to bear it out, and the American Academy of Pediatrics recommends pacifiers after a certain time, but not in the first days of life. Practically speaking, babies love to suck, and non-nutritive sucking calms them down, so babies, even in the first days of life, if they're stressing out, we oftentimes give pacifier. It's probably better if we didn't. In other words, more kids would probably be successful breastfeeders if we didn't, but it's hard. It's a hard thing to avoid, calming a baby.
Right. I think also that is one of those things that also goes into the area of, well, my parents did this, or a parent or a grandparent saying, well, we always did this and this worked, so,
Right. A lot of things get passed on that way.
Yeah. In terms of that passing on of things from parents and grandparents and moms and grandmothers in particular, do you find that with the sort of current generation of new moms that their mothers or grandmothers either encourage or discourage breastfeeding, or all over the map, or?
Yes, all over the map. I mean, I just came running here from Paoli Hospital, where I just saw a brand new baby, and the baby was latched on for the first time. They were just born, And the grandmother was there helping the mom, was holding the breast in a position so the baby could get on their first latch on the mom's breast. So there's one where the grandmother was right there, really very helpful and supportive. But on the other hand, you also have grandmothers who do not breastfeed their kids and don't really know about breastfeeding, so it's hard for them to be as supportive. I will say again, though, most of the population around here seems to want to breastfeed, and they're sort of, craving support.
So if a new mom wakes up at 4 in the morning with difficulty breastfeeding, what can she do now?
Well, how many days
what are
old
her
is she?
options? So the baby's a week old.
Baby's a week old
and was not premature.
Was not premature and has already seen the pediatrician, and they weren't losing too much weight and weren't too jaundiced.
Right, so it's sort of garden variety.
Garden
now, we're not
variety.
Talking about medical emergency here.
We're talking a fussy baby who doesn't want to settle. I mean, of course, trying to feed is important if the baby's not going to feed. There are nice ways of learning to calm fussy babies. And there's a Dr. Harvey Karp who created a little system called the happiest baby on the block, in which his theory is that babies still want to be in utero for the first 3 months of life. So we do what we can to try to recreate that situation. The theory is a theory, but what comes out of his theory are some really nice practical tips on calming fussy babies. And I do recommend that my families look up Harvey Karp and Happiest Baby on the Block and read his book and look at some videos just to develop some baby calming skills. Also, when I see babies, every time I see a baby, I make them cry, because that's what pediatricians do, is make the babies cry when we're examining them. But I also then show parents my swaddle, like how I swaddle a baby and how I hold a baby and rock a baby a little bit to calm them down, so that they see they are empowered to be able to calm a fussy baby, because fussy babies can really get to you, especially when you're tired. So having some concrete steps to take is really nice, so I mean, I do endorse Harvey Karp's methods. I don't get paid by Harvey Karp or anything, but I just think he has a nice system, which is helpful.
And what are some of the reasons a baby might be fussy other than being hungry?
Well, they could be sick. They could have trouble breathing, stuffed up nose. Babies only breathe through their nose, and if they get a little mucus up there, it's hard for them to breathe, and so they might be fussy because they're not breathing comfortably. So making sure that their nose is clear, some salt water drops down there, or gentle suction to get something out of there is a possibility. They may have some gastrointestinal distress, perhaps, and they hadn't had a bowel movement for a couple of days. I mean, the reasons that babies can be fussy are manifold, of course. It's hard to, that's a tough one to pin down in a couple of seconds.
Yeah, I guess I was really trying to get to that sort of the easiest thing to do when you have a fussy baby is try and feed it.
Feed, and change,
right, and especially with the feeding, that can be, partly related to later obesity, if we always feel like, okay, there's a problem, food.
I mean, it's a great question, and that's why it is. Many people do go directly to feeding, particularly bottle feeding babies. If you're feeding every time the baby fusses a tiny bit, then you do create that that sort of reflex and maybe overfeeding, which can lead those cells to have a tendency to become more adipose tissue.
What are some of the ways that other members of the family can either encourage breastfeeding and help make it work well, or some of the ways maybe that, although unintentionally, they might be discouraging breastfeeding? So how can we really promote it?
Yeah, that's a great question. Certainly, the breastfeeding mother is one to be cared for. People should be taking care of the breastfeeding mother, making sure she stays well hydrated and well fed, and doing the things around the house that, cooking and cleaning and taking care of the other things around the house are really important for family members to do, so that the breastfeeding mom can kind of relax and bond with her baby and spend time and feeding her baby. So I mean, I guess that's the main way, main ways that people can support, and also to be supportive and not, and recognize that not every feed's a great feed, and recognize that not every time a baby's crying that they need to go right, you know, oh here he's crying, you got to feed him, you know, being aware of that is important. So if everybody can learn how to calm fussy babies too, that would be nice.
Great point. Are there any employers that you have come up with really great creative ways of facilitating breastfeeding promotion that you've heard of around here? Or
I don't know any specifics. I mean, I know I have patients who work for certain companies, and within that company they have a hotline for breastfeeding. So that company has hired like lactation consultants to answer calls, and they may even get visits. So that was, I thought was pretty creative. I can't remember the name of the company, sorry, but I was very impressed that they had that set up, that they had that those resources available to their workers.
Once you start offering solid foods, that should be around what age, and how does that affect breastfeeding?
It should be around 6 months. Before that, you know, all the babies need is breast milk, but they should also get some extra vitamin D. Breast milk does not provide enough vitamin D, so 400 units of vitamin D per day is recommended. Moms can also increase the vitamin D in their breast milk by increasing the amount they take in. I did see it. It seems like they have to take an awful lot to get enough for the baby. So just an extra 1,000 or 2,000 units is probably fine, but the baby should still get their 400 units. So babies themselves should start eating around 6 months. You know, historically we start any time between 4 and 6 months, but the official recommendation is really about starting around 6 months with supplemental foods. And the baby's iron stores drop around 4 months, and so it's important to add iron-rich foods, especially around, you know, certainly by that 6 month time. So these iron-fortified cereals, and you can get into green vegetables and fruits and even proteins earlier on than we used to recommend. So you like to march along just one food at a time, you know, so you start with, say, carrots, and you give carrots for 3 days, and day 4 you can have carrots and something else new. So you don't have to separate the foods, but just keep an eye.
And then should you be breastfeeding before you give those foods, or after, or it doesn't really matter?
It doesn't really matter. I mean, I think you have to, you learn about your own baby. You know, some kids wake up, they got a nurse before they'll even can talk to you. You know, other kids won't eat any food until, you know, so you want to maybe have them hungry to eat food and then nurse them afterwards. So that's just individual.
You mentioned that there's about a lot of the different research that has gone on and is going on about breastfeeding. Are there particular areas that you just feel personally you'll be interested to see what they find out about X, Y, or Z in terms of, you know, research that's ongoing now, but we don't have the results yet?
Yeah, I mean, that's a great question. I'm really fascinated by the microbiome and the fact that, you know, our body, we have 10 times more bacterial cells on and in us than make us up. So that's pretty crazy. The human body is made of about 1 trillion cells apparently, and there are about 10 trillion bacteria in and on us. And we're learning more and more about the intestinal microbiota, or the microbiome, and how that affects our immune system and our health. And so I think that's a really amazing area of the future, which, you know, leads to sort of how we're going to use probiotics and things in the future. But really acknowledging and accepting and realizing that we live in an ecosystem that's dependent on all these other bacteria. I think that's an amazing field.
I guess just as a final question, I'll just ask, or what are some of the most kind of common questions you get from prospective parents about whether or not they should breastfeed, and what are some of the, you know, like the top 3 messages you try and give women and families about the importance of breastfeeding?
top three messages that I give for parents about the importance of breastfeeding is the health of the child, and the health of the family unit and the mother-infant dyad, so that it's a wonderful bonding experience, of course, and that's a great thing for human development, you know, for their way in the world and their emotional development, in addition to their physiologic development and their protection against bad disease, and the promotion really of positive, healthy eating habits early on. So I really like to encourage breastfeeding, because then hopefully that develops positive behaviors around food, and hopefully to help prevent obesity as well, because that's, you know, an issue in our society. So I guess those are the main points I'd like to get across.
Do you feel like that you learned a lot of what you've talked about today when you were in medical school, or do you feel like really hopefully they're doing a better job with teaching about breastfeeding now because you've really learned most of what you're talking about since your training?
Right. So yeah, I mean, great question. I certainly, you know, I have a 22-year-old daughter and a 19-year-old son and a 14-year-old son, and certainly they were all breastfed, and I learned a lot then from them, not from medical school, but or from my residency even, but from having those kids I learned a lot. But then I went for about 17 years in practice until I became much more passionate about breastfeeding. And so it's really these past 3 years or so that I've become very passionate about supporting breastfeeding and learning more about breastfeeding and why it's important, you know, to the extent where I created this little practice of taking care of well babies for those 2 days, because that's a time when I know and I can help. Fortunately, I think medical schools are doing a better job, and some residencies are doing a better job. There's a wonderful program at St. Christopher's that I know about, where their residents are learning about breastfeeding. And one of the doctors is a MD IBCLC, and helps run the clinic there, and so they're very aware of it, and they do a great job. So, you know, again, I think society is doing better, and we need to keep on pushing ahead in that direction.
Terrific. Are there any final points you would like to make about this that I haven't asked about but you feel like are key?
I think we hit most of the positive points about breastfeeding. You know, I don't know.
Okay.
Sorry.
Okay, well, for our audience, we will be having a list of web resources. And once again, I want to thank you, Dr. Joshua Rabinowitz, DO, Fellow of the American Academy of Pediatrics, Chief Well Baby Nurseries of Mainline Health, Director of Advocare Newborn Network, and a partner in Advocare Mainline Pediatrics. Thank you so much for your time today, Dr. Rabinowitz.
Thank you. Thanks for having me.